So a couple of years ago, when I was a junior doctor, I was interviewed by a friend of mine called Ali Abdal, who, for those who aren't familiar, runs a YouTube channel teaching people about different aspects of getting into medical school and succeeding once you're at medical school. And he asked me various questions about different approaches I take to medical school, things like how to study efficiently, how to organize your time, how to learn on the wards, how to balance your studies and your personal life. Essentially all the questions that we felt would be helpful for somebody who was at medical school or just starting out medical school and wanted to get some tips on how to approach it and how to be successful. And so he then compiled those videos and shared them as part of a sequence of videos where myself and several other people that he spoke to all just shared our thoughts on different aspects of medical school. But I thought now that I've started a YouTube channel, I might as well compile all those videos into one place. Most of the ideas that I share in this video, which are all on this subject of succeeding at medical school, were taken from a book that I wrote just as I was finishing up medical school, and when I qualified and was working as a junior doctor. I wrote this book, it's called The Modern Medical Student Manual, and if you're somebody who likes to read, then I'm giving away free copies of this book. If you click on a link in the description, then you'll get information about how you can get a free copy. And yeah, if you're the kind of person who likes to read, then check the book out. If not, watch this video. If you like the video, maybe go get the book. It's up to you. So without further ado, I hope you enjoy the video.
I think one point to note that's really important is that hospitals are designed to treat patients. They're not designed to teach medical students. So therefore it's really important to be proactive with your learning in order to get the most out of your time on the wards. One thing that is important is to always have an objective and know what it is that you want to do on any particular day. So maybe one day you might decide that you're going to practice taking bloods, or you're going to practice taking histories or examining certain types of signs. And obviously there's lots of general stuff that you can learn on the wards, and you could go in with I think what a lot of people do is like quite a passive approach and just think, okay, I just want to learn medicine today, and you go in and just try and passively absorb things. But I think it's useful to actively have a approach that you want to take and things that you want to learn. So therefore, what I found useful was always like the night before any day of work, I would think of about 5 or 6 priorities, just write them down on a bit of paper in my pocket. And then when I was on the wards, I'd be thinking, okay, how can I achieve these aims that I've set? How can I achieve these objectives? So if it was like, okay, I want to practice taking bloods today, or I want to learn about liver function tests today, then it would be like, okay, are there any patients with a liver pathology on the ward? And then going and talking to them, maybe taking a history, looking at their blood tests, looking at the liver function tests, how they've changed, what the different markers mean, and if they've gone up, if they've gone down, why that is the case, and what kind of pathology it suggests they might have, and talking to people about that and really getting an understanding on that, for example. Or if you wanted to practice taking bloods, then going and maybe following the phlebotomist, or just asking the F1 that day, are there any bloods that need taking? Do you mind if I go and take them? And just doing lots back to back to back, I think is also quite useful. So that's the first thing is, yeah, just having an objective is very useful and important. I think tagging on to good teachers is like a really good bit of advice that I got. Some of the people that you're working with will be very interested in teaching, others won't be as interested and they're more focused on just getting the work done. But someone who's interested in teaching and who is good at teaching is absolutely invaluable. So if you find someone who's like that, just tag onto them and basically milk them for all they're worth. Like, try and get them to teach you in off moments on the ward round, in the afternoon, ask if they can go through a certain topic, and just try and absorb everything that they say and learn from that. So that I find is incredibly useful, and that can make or break a placement. Just having one doctor who's keen to teach and is experienced in teaching and is good at teaching can make a huge difference. You can learn so much. So the third point I would say is, don't be afraid to leave some sort of teaching experience if you're not getting a lot out of it. I think it's easy to spend a lot of time on the wards. Like, you could go in solidly from 9 till 5 and feeling good and feeling like you've been productive, but actually it might be that there was a lot of downtime which you didn't really get a lot out of. And I think the first point, having an objective, can help, because in those downtimes you can go away and do something, but it's also really useful to have in your mind that if you're not getting a lot out of it, it's not wrong to leave. Like, if you went in for the morning and you have a realistic idea that there's not going to be much opportunity for teaching, maybe the doctors are really busy that day, maybe there's just not many interesting patients left, you've examined all the patients on the ward, it's completely reasonable to leave. And it's the same for clinics, it's the same for theatres. Sometimes surgeons or doctors might make you want to stay or kind of put pressure on you to be there, but at the end of the day, you're responsible for your own learning and your own time. So I think it's completely reasonable to just get up and leave if you're not getting something out of it, because you're there to learn at the end of the day. So I'd also say one thing that is useful to really make the most of your time is to always be relating what you're learning on the wards to your reading. And this can kind of be done in both directions. So for when you're on the ward and you see some interesting condition and you learn about, a few different patients that came in that day, it's really useful to go home and at the end of the day, spend a bit of time just reading about those conditions and consolidating and understanding the patient's case, like why were they given this particular treatment, what was it about this presentation that led the consultant to come to this diagnosis, and really understand the rationale behind it. And then you're much more likely to remember it longer, because that experience where you see the patient and talk to them, it kind of, I've heard it described as like, it gives you like a hook to hang the information off. It's much more like to stick in your memory. If you can picture a face and picture a person's story, then that can be a great way to remember the important clinical information that you need to know. So next time you see a patient maybe with similar sort of pattern of symptoms, you can think back and remember that particular patient and be like, well, what happened then? Okay, the consultant asked about this important question, and they were thinking about these sorts of treatments, and then you can use that information later. And I think it's also useful to go the other direction and use your reading on the wards. So when you see a patient come in, let's say Parkinson's disease, and there's a patient coming with Parkinson's, and you've done some reading about Parkinson's, then before you even know anything about the patient, sometimes it's easy to mentally go through, or sometimes like I just grab out a bit of paper and write down, what do I know about Parkinson's? What would I be thinking about in this patient's case? If I was taking the history, what kind of questions would I ask? What examination findings would I expect? What kind of treatments could they be on? And then going ahead and looking at the notes and seeing, okay, so they're taking this medication, which I know is like a first line or a second line drug, or they're taking this combination, they're taking this dose, so that suggests that maybe they've had Parkinson's for a long time. So when I examine them, they might have strong signs of Parkinson's, and then you go and see them and it kind of confirms that. And again, that adds this linking element of your learning, of bringing the clinical experience and the academic knowledge together, which is really useful. A lot of those ideas that I've just spoken about, I've kind of written down, I think maybe a little bit more clearly than I'm able to say them right now, in this book that I published last year. It's called The Modern Medical Student Manual, and all those ideas are covered in chapter 3, which is really about how to make the most of your time on the wards and how to essentially do all of the points that I said, but just explored in a bit more depth. So one thing I found really useful when thinking about how to prepare for OSCEs was this idea of deconstructing the different parts of the examination and practicing them in isolation. So for example, when you're in the OSCEs and you're doing an examination, let's say the cardiovascular examination, you can divide that into a few different stages. One stage and one skill that you need is knowing the examination schema. So knowing, I'm going to start with the hands and I'll go to the arms and the face, and knowing exactly what you're going to look for at each stage. And that in itself can be learnt very well in isolation. And then another element of the examination is being able to recognize signs. So being able to hear a murmur and go, okay, that's an ejection systolic murmur, or that's a pansystolic murmur, or if there's like hepatomegaly present and like how you would describe hepatomegaly, that sort of thing. Another component is putting everything together. So realizing that they've got swollen legs and they've got crackles at the bases of their lungs, that this might suggest they've got heart failure, and then looking for other signs or maybe signs of causes of heart failure, and the practice of putting all of the clinical signs together to build up the bigger picture. I guess you could also then say that the viva, so the bit where you're presenting your findings and talking through the results, what you found and what your reasoning is kind of another component. And one thing that is useful about this kind of deconstructing approach is then you can think of specific targeted ways to practice each of these components and then integrate it all together at the end. So for the first component, practicing the schema, okay, so you can do that on patients, which is quite common, like you'll go into the wards with friends, with colleagues, and go and examine on patients. But the thing is, that's maybe not the best way to learn that part, because you won't be examining a high volume of patients in a short period of time. You'll probably go and see a patient, maybe then your friend will take turns, and then you'll go and find another patient, but then maybe that patient's gone away or they don't want you to examine them anymore, and you're constantly going to different places. And it's a reasonable expectation to examine maybe 4 patients in an hour. Like that, you'd be doing quite well if you examine that many. If you're doing it with a friend and you're alternating, you might only examine 1 or 2 patients in an hour. So if you really want to get practice at just doing that schema and kind of have it almost at a subconscious level, there's other approaches that might be quite useful, such as just finding a friend and continually examining each other until it's kind of subconscious. I know some people even like do it on their teddy bear or on their pillow and just continually repeat that, and that's a useful way to learn that part of the examination. The second part of that is recognizing signs, and that's something that obviously largely needs to be done on patients. Like you need to listen to lots of different murmurs, feel lots of different livers, examine lots of different hands to get an idea of the signs and recognize what's normal and what's not. And so that's something that you can be doing on the wards. You might decide one afternoon to just go and do as many cardiovascular exams as possible and go to all the different wards. Obviously the cardio ward, but then also maybe the elderly care ward, because there's like to be some aortic stenosis there, and going to other wards and trying to just experience the different types of cardiac murmurs, say. And then another day you might be focused on looking for another kind of condition, like maybe looking at neurological conditions, let's say. And to some extent, it's not easy to have exactly the right patients in the right place, because obviously there's natural variation. You don't know if there's going to be a patient with any particular sign in the ward. So it's also useful to just spend time on the wards and just always be aware that someone might have this. If someone comes in with a certain condition, you can go and find them and talk to them about that condition and examine that and learn to recognize some of the more rare signs. But definitely anything common, which you're likely to see in your OSCEs, you could spend like an afternoon just going out of the hospital and seeing as many of those conditions as possible and seeing the natural variation in that. When it comes to studying for written exams, there's a few kind of neuroscience principles that I came across that I found extremely useful for medical school. The first one is something you may have heard of, which is spaced repetition. And that's this idea that you forget ideas relatively quickly. So if you learn something, it starts off that you remember like 100% of that for a certain period of time, and then it continually decays and it levels off around 5-10%. But actually, if you then repeated that content a day later, it would bring it back up, and then it wouldn't leave your brain as quickly. And then if you did that maybe a week later, then that would bring it back up again, etc. And so I found structuring my revision around spaced repetition was really useful, because I found it like helped me to remember things more easily. And there was I kind of created this system which I used to put in all the topics that I needed to learn, which used spaced repetition. So when I learned a topic, I'd put it into my daily review system, and then I'd review that each day. I'd review the daily reviews and then put that into a weekly review, monthly review, which I've got an example of that in this book that I wrote for medical students. So this is the table that I use, and this is just a screenshot of it, which I found very useful. So it meant that I was always covering the knowledge and then reviewing it relatively soon. So it was still tough to remember what it was each time, but then each time it was getting easier and easier, and it just stayed in my memory for a lot longer. So that was really useful. And another principle that I found really useful is this idea of understanding content versus memorizing content. And I think there's a bit of research has been done into how some people kind of predominantly will rote learn content, and some people will predominantly try to understand the content. And the evidence shows that you remember things better if you understand them more, and that you can shift yourself more from a memorizing approach to an understanding approach. So for example, if you wanted to learn about lung function tests, you might rote memorize how FEV1 over FVC ratio goes down in obstructive disease and it goes up in restrictive disease. And you could just rote memorize that, and you may be able to answer an MCQ on that as long as you remember which goes up and which goes down. But if you were then like a year later you had the same question and you couldn't remember exactly which went up, which went down, if you develop the understanding of, okay, in obstructive disease the lung doesn't push out as quickly, therefore the FEV1 is down but the FVC is the same, and therefore the ratio is going down, and vice versa in restrictive it doesn't expand fully, you could then work it out from first principles. And that's quite a simple example of that, but you can apply that same principle to anything. And essentially the way my friend talked about it is, the deeper you go with the understanding, the more likely you are to be able to rework things out from first principles when there's a bit of information that you've forgotten, or an idea you haven't covered for a while, or maybe even something that you're unfamiliar with, but you can reason what the likely answer is. So one thing to say about productivity is that productivity is a tool, it's not the end goal. You shouldn't be trying to just be productive. you should be being productive so that you can get something done, so that maybe you have more time to do other things, or maybe so you can do better in less time. And I think one element of this is deciding what to be productive about. Like, you could be really, really productive and study loads of like niche medical content, but then if that content's not useful to you and you're not going to use it in your exam, or you're not going to use it later in life, then even though you've been productive in the way you've studied it, you haven't been productive because it's not useful information. So a large part of productivity is thinking about what you should be learning and deciding what's most important for you at any particular time. So for example, when I was at medical school, like, I decided I'm not going to be coming like top of my medical school. I'm not going to be getting great marks, partly because maybe I'm just not smart enough, or I'm not willing to work as hard as I could to get to that level. So I set myself the target of just coming within the top 25% in everything that I do, and being completely happy with that and not trying to go much further beyond that, always aiming for about the top 25%. So when I was learning medical content, I would always ask myself, is this something that someone around the top 25 would know? And if it was something that was so niche that I don't think I'd ever use it in medicine, and it might get me a few extra marks in the exam, but it's only going beyond that 25% mark up to like the top 10% mark, then I'm not so interested in doing it, and I'd rather not study that, study something else, or just go and do something else. So that was kind of my guiding principle, I think, for medical productivity. So I think work-life balance is one of the big difficult questions of medical school, and I think everybody can at times swing it one direction or the other. Sometimes you'll be working too hard, sometimes you might take your foot off the pedal a bit too much and then get a bit stressed before exams, that sort of thing. I think everybody has their own balance for them to find. Some people really enjoy working and spending a lot of time doing that. Other people prefer that to be one component of their life, but to also have lots of other things going on as well. So I think it is a personalized thing about finding your balance, and it does take a lot of time. I personally feel my first few years I probably worked too hard, and then in my third year I don't think I worked hard enough, and I feel I started finding my balance around fourth or fifth year. So I guess that's a benefit of having a 6-year degree, because you have a lot of time to test that out and find your balance. And I think the main thing that will help you to find a work-life balance is just being aware of what's important to you. Like, what are your priorities? Do you want to be one of the best in your medical school? Do you want to be a really academic doctor who knows lots of information and always goes above and beyond? Do you want to be someone who is ambitious in other pursuits outside of medicine itself? Are you someone who much values friends highly and want to spend a lot of time with other people? And I think there's a few useful approaches to kind of getting this insight. There's a couple of interesting ones that I came across. One technique I found quite useful is this idea of asking why 5 times. And what this is it's when you're trying to assess your motive, the first answer that you give might not really answer the question, but if you keep on probing it with why, you'll get to the real reason. So for example, I studied really hard in my first few years, and I could ask myself, well, why did you study so hard? Well, it's because, I wanted to get a high mark. I said, well, why do you want to get a high mark? It's because I wanted people to see that I was smart. It's like, well, why do you want people to see that you're smart? Because I value, some of my like self-value comes from whether other people think I'm smart or not. And it's like, well, why does some of your value come from whether or not other people think you're smart? And it's like, well, that was just kind of something that I experienced at school. Like, I was always doing well, and it became part of, part of my identity. So then what's the response? Is it to just stop working so hard, or is the response to ask, well, why is that important to you, and do you think it should be that important to you? Is it that important to you to becoming top, for example? And I think it's a really broadly applicable technique. You can use it in so many different situations, but that's one example of a time when it's been useful. I've written about that in this book, as well as a few other techniques. There's this interesting technique I read about how to kind of visualize yourself at your own funeral and what people would be saying about you and that sort of thing. And I've written about that in here as well. But those are some techniques that I found useful for finding work-life balance. My approach to medical school was always to try to get to the point where you don't need to take notes in the lectures. So I would always prepare for the lectures if I found time to skim through the notes so that I'd know enough to keep up with the content that was in the lecture, and then just focus on trying to take in as much information as I can during that lecture, and making notes only of the very, very essential key points, which I could then refer back to and expand on later from my memory. Because I think it's easy to kind of be writing down a lot of the stuff that the person's saying, have it going into your ear, going down, writing it onto the paper, and actually not really processing it. So therefore, you could sit through a whole 1 hour lecture and you might have beautiful notes, but it wouldn't be in your head, which is where it's important to have it at the end of the day. So yeah, that's my approach would be, think about not taking too many notes.
So I hope you enjoyed these videos. I guess if you made it to the end, you probably did, at least to some extent. If you're interested in watching more videos like this, then I will leave a link in the description below where Ali has shared some videos where essentially it's similar sort of format, but 5 or 6 different doctors all asking the same sort of question or answering the same sort of question. So definitely worth checking that out. And I'll see you in the next video.